Hello, Dr. Robert Arnone coming to you from St. Louis, Missouri. I'm a head and neck injury doctor and focusing mostly on concussions and post-concussion syndrome and similar type injuries. So today we're going to talk a little bit about chronic traumatic encephalopathy, CTE. What is CTE? Well, just looking around for a basic definition, Boston University on their website or in their CTE unit, they talk about how it is a progressive degenerative brain disease. And it's associated with repetitive contact or trauma to the head. So, for example, we may see concussive blows that are symptomatic, where there's a hit to the head and I'm dizzy. There's a hit to the head and I've got a headache, or I can't see properly, it's blurry, or I've got ringing in the ears, or balance problems, forgetfulness, many different problems that could happen with that, like that we might see in a concussion. But there's also hits maybe that will seem to be subconcussive hits or repetitive traumas that don't seem to bring on symptoms. So I get hit to the head a number of times, maybe boxing, and there's jabs, and it's not enough that, I've got trouble, I can't stand, or I go home and I've got blurry vision, headaches, things like that. So they all matter. We did a video recently on this. We talked about the subconcussive blows. So it's the subconcussive blows as well as the concussive blows, the combination of them over time. It's the repetitive trauma. It's common in athletes. This has been known going back to the 1920s with boxers, more recently with football players that have been studied and analyzed, and we're finding it in them after death. And there's a protein, abnormal protein in the brain called tau protein that's associated with this that builds up. And so basically what happens is the brain is dying. Okay, and this is how the person eventually can die from that in time. But usually with the brain dying so much that they have other problems. And part of it is they can't control themselves. There's an inability to control certain functions. There's aggressiveness, there's depression, there's forgetfulness. It's similar to Alzheimer's, and it mounts to a point of progression to like a dementia, where the person just totally loses any kind of reason, any kind of concentration, any kind of speech even that makes sense. It's all just such a problem in the brain that mounts. It is scary. So here's the thing we want to tell you about this though. It happens as a result of the trauma over time. We know with concussion that the injury, the main injury, is at the base of the skull, the top of the neck. The effect of the injury is up in the brain and up in the head. Now, if we have a concussion injury where we have a subluxation in the upper neck, the bones get into the wrong position, how could that affect the brain? Good question, I'm glad you asked. Basically what happens is the brain stem, which sits in this area down in here, sends impulses to the brain. It's the source of function to the brain. And so if we have subluxation where the head and the neck get misaligned, now instead of surrounding and protecting, we're actually twisting and putting torque and tension and choking off that brain stem. It cannot send impulses to the brain properly. And over time, we have less and less and less brain cell function. More and more and more brain cells dying, getting sick, functioning abnormally, brain cell death. This is more of the CTE part of it. It's like a concussion that was never fixed, and the problems are there, and we look at the person 20, 30, 40 years later, the accrual or the accumulation of the destruction shows up bigger later. We say there's a better way. Once you find out what's been happening, I always recommend first having an MRI done of the brain, see if they'll go low, see if they can go to C2, C3. C3 would be ideal, so we can get a look at the upper neck as well. get it on disc, and send it over to me, and let's talk. There's a better way, much better than just waiting and saying, I feel pretty good. Actually, there's a problem. You're either getting better or you're getting worse. You're never just kind of coasting along. And if you've had head and neck injuries and they have not been fixed properly by a specialist who focuses on the upper cervical spine and has extensive experience in dealing with concussions and post-concussion syndrome and head trauma, then you need to do that right away. Literally, the rest of your life may depend on it. For now, take care, thanks for watching, and God bless.